Good afternoon. Welcome to day 373 at the EMA office, where we're joined with Chairman Mark Kern. And today we are honored to have Sam Bierman with us today. I know you took a little break away from the vaccination site, and we really appreciate that.
Oh, absolutely. We are doing well down there. As we have said, our goal is to get shots in people's arms, and we are on the way to finishing up St. Clair County. So as of today, we have tested 305,524 St. Clair County residents, and that is an increase of 590 from yesterday. We have 29,035 positive test results, which is an increase of 30 from yesterday, and that does include both males and females under the age of 10 up to their 80s. And our daily county positivity rate today is 5.1%. And we are at 276,489 negative test results. We are adding no new additional deaths today, so our total remains 464. And for those who have completed the IDPH required 10-day isolation period, we are at 28,142. For state totals, 19,629,022 have been tested, with 1,221,863 positive test results, which is an increase of 1,431 from yesterday. And for deaths, the state is reporting 21,081, which is an increase of 22 from yesterday. For hospitalization numbers in St. Clair County, currently we have 25 patients that are admitted due to COVID-related reasons, and 5 of them are on ventilators. And regionally, we have 71 patients that are admitted due to COVID-related reasons, and 6 of them are on ventilators. We have no new updates in our congregate living facility numbers, so I will turn it over to Chairman Kern for his update.
Thank you, Sam. I look at the hospitalization number. I don't think we've been this low since last fall, early last fall.
It's been a while since we have seen numbers this low.
So that is a great sign. The hospitalization number certainly is one that when you track it, you know how we're doing. And when we have the lowest number in a long time, it's a great thing. All right, let's take a look at the zip codes for today. 62206 up 3 to 1,294. 62221 up 2 to 2,778. 62223 up 1 to 1,758. 62226 up 3 to 3,206. 62232 up 1 to 901. 62239 up 2 to 474. 62240 up 1 to 163. 62254 up 1 to 800. 62257 up 1 to 342. 62258 up 1 to 1,053. 62260 up 1 to 800. 62264 up 1 to 359. 62269 up 4 to 3,267. 62285 up 1 to 569. And 62289 up 1 to 49. 30 new positives today. Only 590 people tested. Makes that positivity rate 5.1%, which is a rise in that rate. Our 7-day rolling average then goes up to 4.5% today, as does regional positivity, which goes up to 3.3%. That's derived by Bond County, which came in at 0% today, Clinton at 2.2%, Madison 3.8%, Monroe 4.3%, Randolph 3.4%, St. Clair 4%, and Washington County is at 0% today. So everybody's under 5%. Herb, hospitalizations are down, but the testing is down, and we need to make sure that people continue to know that testing is available. Get tested. If you think you've been exposed or you even feel there might be a chance, let's get that virus isolated. We still had 30 new positives today, and then if you're not getting tested, there may be more than that out there, but 30 of them have been diagnosed.
And it's when you end up in the hospital, then it's really serious. So you want to make sure you try to head that off. So testing is so
And
so
the
important.
key is that we need to make sure that we get the virus out of this community before it morphs into these other strains that we see coming in the United States, which now are a large percentage in some states. These new variants are a big part of what they're seeing. We don't want any new variants. We're having trouble enough with the old one.
Yeah.
So let's get this out of our community so that we don't start to morph this into something else.
We talk about wanting to close the door on this one. That's what we want to do, and we're going to padlock it, nail it shut, and the rest of them can stay away. Today's our question and answer day, and Brian Whitaker is here, going to do the honors of giving the questions.
Okay. Sam, we'll start with the health department questions that came in. The first person said, how will students 16 and older be addressed? Will they need to make an appointment, or will these be done at the school?
So from the state guidelines that were just updated, April 12th is the first date that we will be able to open it up to anyone 16 and older who has not fallen into any previous category. They will still need to make an appointment for whatever location they go to. Remember that we do have not only the fairgrounds, we have our 330 West Main location, both of our hospitals in this area, Memorial and St. Elizabeth's, as well as Touche and Eastside Health District for those who don't live in St. Clair County, for St. Clair County Health Department. But they will need to make an appointment. At this time, we don't have any plans to go into schools, but that's not to say that that option is off the table.
Okay, the next question is, I took my son to get a COVID test yesterday at St. Clair Square. The MyChart app shows no record of his visit. Do you know what the current turnaround time is on getting the test results back?
So it does vary depending on how busy they've been, but we've been seeing a very consistent 36 to 48-hour turnaround time.
Okay, the next person says, is it advisable to enter a 13-year-old on the notification list now, even though it will be some time before anybody under 16 would be eligible?
So the answer to that is no. Every piece of information that we've been given by the state as far as a pediatric vaccine for COVID is still quite some time off. So please do not enter anyone that is younger than 16 on the vaccine notification form. When we get to that point, you will still have to get them on another list at that time. So we would hate for you to put them on and think you're ready to go.
Okay, the next person said, can you explain how people that are homebound are going to be addressed?
So we've been working with some partnerships that we have with local home health agencies that already service most of these individuals. And we have a group at the health department who is putting these individuals together so we can make sure that we address everyone that isn't able to get out to one of our vaccination sites in the county.
And we're actually, Mila is going to be over tomorrow, come to the EOC. We're meeting with a provider that's hopefully going to help with that, actually be able to maybe spruce that up a little bit and make sure nobody falls through the cracks.
Yeah, and we are aware that we do have those citizens in St. Clair County, and figuring out the best and most efficient way to get to them is certainly on our priority list.
Okay. Next person said, is the Illinois Health Department collecting SARS-CoV-2 samples from our region to track for other variants, or is the surveillance only being done in the Chicago area? And they follow that with, is there any cases of the new variants in our region?
So we have sent a handful for variant testing. We have had no positives come back, but yes, if the individual does meet the criteria, we are sending that sample for testing.
Okay, the next person says, will you provide weekly and cumulative totals for the number of persons vaccinated in the county and state?
So we do provide those, but they are also on IDPH's COVID page under vaccine data. This data on IDPH's website is updated every week on Friday. And as of now, we have vaccinated 107,383, we've given 107,383 doses of the vaccine, and 44,608 of those individuals are fully vaccinated, meaning that they have received both shots of either Pfizer or Moderna, or have received one dose of Johnson & Johnson, and that equals out to 17.09% of our population in St. Clair County.
Okay. The next person says, I'm scheduled for my second dose today, but one of my family members is sick, possibly with COVID. Should I hold off on getting my second dose because his test results are not in yet?
Yes. While you have one vaccine under your belt, it is best, and it is still the guidance from the state to continue. If you think you have had exposure to someone who potentially might be positive, to wait until they get their test results to be safe. So yes, you would still need to wait for those test results, and if they are positive, then you would need to quarantine for 14 days from the last date of exposure.
Okay. The next person says, before the new priority groups were added on Friday, finance and legal were included in the next tier. They're still eligible in Chicago on March 29th. What is the status of the finance and legal groups in St. Clair County? Thank you for everything you do.
So we have received some updates from the state. As of tomorrow, March 22nd, we will open up to higher education. So that is anything above 12th grade, anyone associated with higher education, media, and any government employees. The following week, on the 29th, we will open up to construction, clergy, and food service. And then 2 weeks later, on the 12th, anyone that is interested that is above the age of 16 will be eligible to get the vaccine.
And Sam, these are state rules that are set out for us,
Yes.
the recommendations of the Illinois Department of Public Health. We are asking to maybe open up these categories. As we see appointments available, we want to make sure that we fill our days. And so we are constantly working with the IDPH to let them know if we feel a little slack in the system, that they maybe open it up a little further. So right now, we're following those guidelines that are presented to us by the state, and we adhere to those. But we do understand people wanting to get the shot that are still out there. There's a lot of pent-up demand, and we are asking that we open things up more in the state so we can get more people through our site.
Yes.
Okay, Sam, one last question for the health department that was sent in. Says, if you have had both of your COVID vaccines and come in contact with someone who is COVID-19 positive for an extended period of time, does the person who had both shots still need to isolate, and if so, how long? Secondly, they say, does the COVID-19 shot lessen the effects if you do contract it?
So for the first part of your question, so if you have had both doses of either Pfizer or Moderna, or your single dose of Johnson & Johnson, and are past 2 weeks post either your second dose or the first dose of Johnson & Johnson, you do not need to quarantine as long as you are asymptomatic. Now, even if you have had both doses, Pfizer or Moderna, or your one dose of Johnson & Johnson, and you do get symptomatic, we do ask that you get tested simply because we want to make sure that we don't have any of those variant strains floating around. And if we happen to, we want to make sure that we isolate those individuals as soon as possible.
And normally, if people are sick, they do isolate. They don't want to infect
Exactly.
anyone else. So it isn't anything that you wouldn't do. It could be you have something else other than COVID, and you don't want to get people sick in other ways also.
And for the second part of that question regarding were the effects a little easier to go through if you've had COVID previously and you get it again, it really depends on the person. We've seen such a wide variety of symptoms from individuals, from some people that has really taken them down and taken them several weeks to recuperate, versus someone who didn't even know they had it. They were tested because they were exposed to someone and wind up coming back positive. So everyone is different, and it just depends on the individual.
Okay, Sam, thank you very much. Chairman, a question that came in for you. A person wrote and said, now that the state is being evaluated as a whole without the regions, is it necessary to have the daily updates? Even the governor is giving infrequent updates. It seems like county leadership should follow his lead and lessen the focus. When herd immunity is achieved, will county leadership be able to give up the attention and stop with the updates?
As long as there is a need out there, we certainly will come here and do this. That it's important, as we said all along from day one, that there was an informational source that was provided to the residents of St. Clair County and beyond to tell them the day-to-day facts about COVID-19 as we knew them then and as we know them now. Only 44,608 people have been vaccinated so far fully in St. Clair County. As a county of 260,000 people, we got a lot left to go. So we think we're going to be here a while longer. We certainly, I can't speak for everybody here, but getting your afternoons back at 3:30 in the afternoon would not be a terrible thing. But until we get this virus put in the closet, as Herb said, and locked up with a big old padlock, we're going to be here so we can protect people and inform people and make sure that we get this virus out of here. And everyone has the appropriate information to be able to do that. Wearing the mask, washing the hands, watching the social distance, telling people where to get tested and why they should get tested, and telling people where they can get vaccinated and how they can get vaccinated and what vaccines are available are all important parts of what happens here every day at 3:30. And so we're going to continue this for a while.
Well, I think it's evident. I mean, we're still getting questions on Sundays that our citizens are asking and comments. And, one of the questions today was about can we start posting the vaccinations that have been given. So there's still a lot of more information out there that citizens want. And unfortunately, if there's somebody who doesn't want to watch, they don't have to. We want everybody to so they can spread the word and get it out there, because for 373 days, I'm convinced that is totally what has helped us get where we are today. The Team St. Clair spreading the word and letting everybody know what had to be done. So I agree. I think we'll be here until we get it locked up.
Okay, and then just a few comments that came in. First person said, I've been a resident of the county my entire life. In my 70 years, I've never witnessed such an organized operation. It has restored my faith in some that serve in public offices. Thank each of you for your dedication. The next person said, keep up the great work. Everyone working at these mass vaccination sites deserves our thanks. Job well done. And the last person said, kudos to all. I've tried for several days to get scheduled for my husband and me. We're both 70 years old and not good with computers. I called Mr. Simmons' wife, Mickey, and she connected me with a person named Teresa at the call center, who was the sweetest person. When we got our shots, we would have been done in no time had Dan, my husband, stopped talking with all the guard members. Thank you all for helping save lives.
Well, and those are the kind of comments that make it all worth it. When you have people out there that, that's why we started the call center, because we recognized early on that there were people out there that maybe didn't have quite the computer skills to get registered. The girls and guys in the call center do an amazing job, and we appreciate all the patience that you have that's needed, that help they have shown. But I think just those kind of comments says that there's still a need out there for what we've been doing for 373 days. One comment on here, Noella says that today was amazing at the fairgrounds, in and out in 15 minutes, no waiting. Again, well organized. Thank you. So, Sam, I know you'll spread that word down there. We get those comments all day long. The National Guard, your medical staff, the job you and Mila and the health department's doing is really recognized by people here in St. Clair County.
That's very sweet. It has been a team effort down there. Not only the medical staff, the guard, the health department staff, EMA staff. Our highway department has come in and really helped out with, making the drives and the potholes a little easier to get over. We've had the tent companies out there. It has been a true team effort to get where we are and to finish vaccinating all of the residents of St. Clair County. So.
And 6 days a week, one
Yes.
day off to sanitize and to take care of filling holes and all the things that hang fire during the week. But that is an amazing operation to do that 6 days a week, 8 to 8, 12 hours a day. It is a monumental task, and we appreciate everything.
Oh, absolutely. I mean, we're happy to do it, and I think what is fueling us now is we can see that light at the end of the tunnel. We're getting closer, and as each week as we open up to new categories for those that are available to be vaccinated, we're getting one step closer.
Well, and that's what we're looking for, is for that day that we don't have to be here any longer, and that will be the day we'll all celebrate. But right now, 373 days we'll be here, and we'll be back tomorrow for day 374 with more information. Everybody have a good rest of the evening. Thank you.
On behalf of the O'Fallon, Shiloh, and Greater Belleville Chambers of Commerce, we ask you to wear your mask, wash your hands, and watch your distance. By doing these 3 simple things, you will be supporting our businesses, all who have had a difficult year. and they need your support now more than ever. The business community understands the risk to our customers, and we want to present them with the safest environment possible. Whether you are able to shop in store, order online, dine outside, order to go, or call for curbside pickup, it is time we all come together. Together, we will stand strong.